create Speranza Human Compassion Project when we began doing some research around the prevalence of domestic violence in communities and the services that were provided to those victims, whether it be at the hospital or whether it be the police officers or whether it be at the shelters, and doing a lot of talking to those first responders individually about their interactions with victims. And what we found is that police officers don't receive specific targeted training on domestic violence care. We provide compassion care training to police, domestic violence shelters, as well as hospitals and healthcare professionals.
As a responder, you should be able to know the red flags and the signs of domestic abuse, no matter how subtle, be able to know the resources that you can give to your patient, and be able to liaise for them, connect them. As a doctor or healthcare provider, you're not only treating their symptoms, but you're also advocating for them.
Training is very essential, I think, because domestic violence is increasing. I think this is something that's well overdue, and I think it would be embraced by the first responders, and I think there's a definitely need for it. And I think Speranza is the organization that can do it.
If you know someone that's in a domestic violence situation, it's very important that you do what you think you can do and still at the same time respect that person as a human being. Because people don't want to feel like someone else is trying to control them, and people are struggling with what they're going through. And denial is a big issue for some people, and fear is a big issue for some people. So just try to be mindful that your perspective may be different from their perspective. And sadly to say, some things have to play itself out, but we don't want it to be that way. We really want to step in and do whatever we can in the very beginning stages.